In today's video, we're going to talk about some of the key factors that would be taken into account to decide whether a joint replacement is appropriate or not. And we're going to start right now. Many of us believe that we need an X-ray to find out if we need a joint replacement or not. Actually, we know that X-rays correlate quite poorly with pain. And what I mean by this is somebody could have quite a good looking X-ray and be in high levels of pain, and somebody could have a not so good looking X-ray and be in no pain at all. So the last thing we want to do is send people for surgery that they don't actually need. They can be useful, but instead of using this one-off 2D image to determine whether you need a referral to an orthopedic surgeon or not, consider it more as a small piece of a much larger puzzle. And the rest of that puzzle we're going to discuss today. One of the first things that will be taken into account is whether you have tried and failed conservative treatment or not. Now, surgery is nearly always last resort, which is why you're often referred for conservative treatment first. And this will often come in the form of a therapist who may give you some education and advice and probably some exercise too. You may also have tried things like medication, heat and ice. Now, if you have tried this for an adequate period of time, and routinely we're thinking probably 12 to 16 weeks, and you haven't reached a level of function that you're satisfied with, then that could be an indication that more invasive treatments are appropriate. In other videos in this osteoarthritis series, I have mentioned that there is a spectrum of severity. At one end of the spectrum, you could be experiencing very little pain. However, at the other end of the spectrum, the pain could be quite severe. Now, normally, osteoarthritis presents as quite mechanical pain, in that when you are at rest, the pain alleviates, and when you're more active and you do more, the pain gets worse. However, in more severe cases of the condition, you might find that you are getting pain at rest and also pain at night. Both of these things could indicate that surgery is appropriate. In conjunction with pain, your level of function will also be taken into account. And back to our severity spectrum, a lot of people that have osteoarthritis have very high levels of function and are able to complete a whole tennis match or 18 holes of golf without too much of a problem. However, if the amount of pain that you're experiencing is getting in the way of your activities of daily living, maybe things like getting out of a bath, going for a walk or using the stairs, then that, in conjunction with the other things we mentioned on this video, could increase your chances of needing a joint replacement. Joint stiffness, swelling and reduced range of movement are all common things that we associate with osteoarthritis. And those things in isolation don't necessarily mean that you need surgery. However, with regards to swelling, we'd normally expect the swelling to go up and down intermittently. In more severe cases of the condition, you might find that the swelling increases for longer periods of time or fails to settle at all. Apologies, I'm interrupting just very quickly to say if you would like to know more about osteoarthritis and all other things pain and rehabilitation, hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you for watching and enjoy the rest of this one. With regards to reduced range of movement, again, in more severe cases, if there has been significant enough changes to the cartilage, then you might find that your range of movement is reduced permanently. Now, this can lead to compensatory movement patterns, which can cause aches and pains elsewhere. And with regards to reduced range of movement in knees, this can really affect your walking pattern. Now, the longer your walking pattern is affected for, the more difficult it can be to get it back post-surgery. We know that our minds and our bodies are intrinsically linked, and that our physical health will have a significant impact on our mental health and vice versa. We also know that osteoarthritis is a long-term condition, and having prolonged periods of pain or discomfort is not unusual. As a result, it's completely understandable that it could affect our mental health. If you do find that the pain is getting you down, making you feel low in mood or even anxious or depressed, then do make sure that you talk to a healthcare professional so that they can help you. Once again, this is just another factor that will be taken into account with regards to whether you need surgery or not. The last couple of things I'm going to mention are your ability to work and do the things that you love and enjoy. Now, if your symptoms are getting in the way of your ability to earn money, it's not going to be too long before that becomes quite a problem and probably quite stressful. And similarly, if your symptoms are getting in the way of your ability to do the things that you enjoy, then it's probably not going to be too long before that starts to feed back into your mental health. If you have got this far into the video, then firstly, thank you very much. And secondly, hopefully you now have an appreciation for the fact that there's far more to making a decision about whether you need a joint replacement or not than that X-ray we were talking about at the beginning. Check the description below, there should be a few links I've popped down there to help you manage your osteoarthritis better at home. And if you're new to the channel, then do hit that subscribe button so you get notified every time that I release a new video, which I do every single week. And if you're feeling really generous, then hit the like button to show your appreciation as well. If you have enjoyed today's video, then you may also like the video that I have put together on the best and worst treatment options for OA, which you can find here. And there is a whole playlist on the channel on how to manage your osteoarthritis at home, which you can find here. Thank you very much for watching, and until next time, I'll see you again very soon.